You know when you have a special day with someone and it's a milestone and you want to celebrate it with them, but they're nowhere to be found? Has that ever happened to you?
Mm.
It's I'm kind of feeling a little bit like that today.
Yeah, same.
Why? Why do you feel like that today?
Well, 1 year ago, plus 3 days, I suppose, our dear friend and co-host, Dr. Flo, made her cameo on the show. And I'm looking at this screen and I'm not seeing a Dr. Flo.
That's true.
She's not here.
Where could she be?
Dr. Flo, where'd you go?
Yep. We've got Dr. Tetteh here,
I am.
but we
I'm
do
not
not have a
Dr.
Dr.
Cofer.
Flo.
No.
No, I mean, it's fine. It's fine. I'm not mad. It's fine.
We've established already, Dr. Flo is at home using all of her Amazon goods. She's playing video games and
VR. She's in the holodeck right now.
she's in the holodeck.
Yeah, I don't live far from her. And the Amazon truck does come to my neighborhood a lot.
Flo actually commandeered one of those too.
Yeah, Flo knocked one of those over.
Yeah.
Shut it.
Flo is she's not down with capitalism.
Flo, you are not being careful with this Amazon stuff. Also, she doesn't need a VR headset to do a fake Measure U meeting. She should actually just be in the Measure U meeting right now. So
okay. Well, let it slide this
That's
time.
a more likely story.
Yeah.
Yeah.
Anyway, a year ago, plus 3 days, I was not even on that episode. I was at a wedding out east. We had Dr. Flo on to tell us about this new thing happening in the country.
This new thing.
And it was a craze that was sweeping the nation.
Yeah, then they were calling it, the COVID-19.
Weird.
And now it feels like we're all a little bit closer to experts on this topic, but Flo had to take a good few weeks off, and so we'll celebrate when she comes back on Friday's episode.
Is that also the anniversary of Flo trying a White Claw for the first time? Was that Flo
Might
who
be.
tried a White Claw for the first time with us?
Wow, this is a monumental episode.
She definitely was not drinking White Claw before she came on the show.
She was
okay,
right, because she explained to us that she was prepping for a marathon, and I decided it had been a while since I had seen Flo, and I didn't want to yuck her yum by saying how I really feel about marathons.
Also, did she end up running that?
She didn't, which is why she had the White Claw. It was her. So Flo, happy anniversary.
Happy anniversary.
Would have been nice if you would have showed up to the show.
I'm a little offended. But I guess you've got a civic duty, and then you've also got that other stuff that you're being cagey about and not telling us about. And maybe we'll never know what you were up to last week. But happy anniversary. Here's to a year of good times of the four of us not being in the same room twice a week.
Happy anniversary, Voices River City. Happy anniversary, Dr. Flo.
Dang.
Beautiful.
You know what? That's
Thank
great.
you. That was an original composition. You will never find it again.
Yeah, I think we nailed it. Start the show.
Voices, the things they said. Voices, some from those dead. All the voices heard. Voices, things we say. Voices, they're in your head. All the voices heard.
Hello, everyone. You have Kempa.
And Skylar.
And Shannon.
And as you all
Dr.
know.
Tetteh.
Oh,
It happens like every time we have a guest.
I know. We need to find a way
We
to
gotta
like
start
make it
building a
more
protocol
clear.
out.
Yeah, no, it's true.
Sorry, I'm sorry. I
No,
was just
it's
flowing
not
with
your-
it.
No, I loved it.
I think it's on us. No, yeah.
Yeah, when we had council member Vang on, she was like, "And my
Hello.
Right. My bad. I guess you have to be introduced, so I should shh.
yeah. I mean,
I mean,
again,
you don't
on us.
have to.
Yeah, I mean,
No.
you can
But-
just jump right in with your
But
name.
this is your show. I gotta follow your flow. And
you
here
are
I-
home here,
Yeah.
so
Okay.
yeah.
Okay.
But we
Whichever
will
you want to
say,
do. Okay.
as you know, listeners, there is no Dr. Flo today because she's at the Measure You convention. But we do have our dear friend, Dr. Beatrice Tetteh. How are you today?
I'm doing unbelievable. How are you?
I'm doing
That is
pretty
such a
well.
good way to answer that question. I'm doing unbelievable
Yeah,
because that
actually,
could be terrible and it
Our-
could be amazing.
that's true. You know, our dear friend, mutual friend Bobby says
Mhm.
that all the time, and I never knew that that could also mean horrible.
It goes
I'm gonna-
both ways.
I'm
Yeah.
gonna
It's a
start
great
saying that
response.
I'm unbelievable.
I am too.
Unbelievable.
I'm like, you have no idea how I am right now.
You would
Exactly.
never guess.
Keeping people in suspense.
Absolutely.
Love
Mhm.
that.
I'm feeling pretty unbelievable myself now that I think about it.
Ooh, fantastic.
Yeah. So, Dr. Tetteh, we are having you on today because we wanted to talk about the rollout of the vaccines throughout Sacramento, I guess throughout the state and nationally as well, right?
Mhm.
For COVID-19. There obviously are some serious gaps in equity. First, can we just why don't we just take a step back and learn a little bit about you first, right?
Okay.
You are a doctor and you started, I think, after I met you, you ended up making the leap, making the dive, and starting your own practice. So tell me a little bit about starting your own practice right before everything changed.
Yes, as you mentioned, I took the leap into private practice and started in September of 2019 at Tetteh Pediatric Health. And I'm in the South Sac, Meadowview area of Sacramento. And pretty much I've been a pediatrician about my 10th or 11th year. And as you said, started my practice and then things changed with the pandemic. And at that time, that's when I started to see not as many children because many people were very fearful and concerned about, well, what is going on? And so I was not seeing a lot of patients for a while. And then I was approached by our colleague, Bobby Roy, because with the API network here in Sacramento, they were seeking a place to do COVID-19 testing that would be able to serve the API community. And they approached me and said, is it possible that you'd be interested, as they were looking for other locations? And I said, well, I'm not really seeing any patients right now. Why not? And so since June of 2020, we've been doing COVID-19 testing partnered with Sacramento County. And we are one of now 13 community testing sites here in Sacramento County. And as you mentioned, as we've seen the COVID-19 pandemic move forward, we've been doing a lot and seeing a lot within the numbers with testing. That in our very first day, there might have been 45 people tested. By the second week, 100 something. At the peak time, which was between Thanksgiving and early January, we had hundreds of people coming in.
Wow.
And during this time, I've heard stories of different people from, oh, I went to dinner with my spouse's friend and then found out 3 days later they had COVID. So I'm here to get myself and my toddler tested. To a person that had gotten together with family members for the holidays, and there were maybe 10 or 12 of them together, and they were calling because they had a fever, they weren't feeling well, and everyone else that had been at that event had COVID-19. And so it's really been a cross section of not just amongst the patients I've been seeing, but even people that have called here about getting appointments to be tested, or people coming here to be tested, just really seeing how much it's affected people. And for me as a pediatrician, seeing how it's impacted the lives of my patients, from the children that are not going to school to the parents of children that were supposed to go to kindergarten or preschool, and now they're at home with just their child, and they're like, well, how do I socialize them? Right. And also just the behavioral health impact and mental health impact on children of all ages, including parents, and not even touching on the financial impact. The number of parents that have come in and said, I was just laid off, or I'm trying to find enough money to pay for this or that, the other, or how can you help me? Or do you know places that can help me because we need to buy formula for our baby? And so as a physician, I will say since last year around this time, that was my last break that I took. It has been every day on doing everything from, okay, which patients do I need to figure out need to be tested? Okay, this person has COVID. What do they need to do about their children and who should see them? And then figuring out recently, people calling me asking about, well, where do I get the vaccine? My child has this health condition and I need to get it to protect them. And so I've seen the pandemic from many different perspectives, not just as a physician, but just as a regular person in my own life, being concerned about if I could be infected, but also through the lives of my patients and others that have come here to be tested.
Yeah. You know, many physicians have talked about trying to serve the community in this last year, and it just seems like there just aren't enough hours in the day. It's like drinking water from a fire hose, right? Having your own practice in South Sac too, which there are portions of South Sac that are predominantly like underserved communities, right? Like Black folks, Latino communities, API, and for folks listening, that's Asian American Pacific Islander communities, some of which, like the Filipino community, have just been just really, really adversely hit by the pandemic. What can you say about your experience serving these communities and kind of how that might differ from somebody in like an East Sac in a land park or downtown?
I think number one would be education that's accurate about the virus. I have some parents telling me, well, this person told me that you can't catch the virus if you're of this ethnicity, so they're not wearing a mask and everything. I had a parent say to me on the phone once, well, I don't believe that kids get this. We haven't seen any kids on the news die of this. I don't think it's real. And then I've had people come to the office that aren't wearing masks. It's just like a mesh that they can breathe right through. And I feel like it's a mixture of misinformation or taking information that they believe as truth that is not. As you mentioned, I think one of the biggest things as well is access to healthcare. Someone called wanting to be tested and they sounded like they had symptoms, and I explained, because from their explanation to me, their symptoms were concerning to me, that they could turn for the worse. And I said, I think you need to talk with your health professional. And they said, I don't have health insurance. I don't have a doctor that I see. I'm scared. And I at least took their information and I made contact with the county and said, I think this person needs wraparound services, because right now, most of the information out to the public states, oh, check with your medical professional, check with your medical professional. But if you don't have insurance, or especially at this time, if you lost your job and your job had your insurance, then how are you able to find a medical professional? But also, as you mentioned, that the different populations have been affected. A big part of that is someone in a job where insurance is offered to them. Many people I see may say they have one part-time job or two to make sure they have the hours, but you don't usually have health insurance offered with a part-time position. And so it's already, when we talk about equity, when we talk about who's being affected the most, it's going to be people, if they have something going on, who can they turn to, or where will they go? But also, even people in many of these populations are in positions where they have to physically go to work. They're not in a position where they can just stay at home and do their work. So we're talking about grocery workers, people that are working in warehouses, postal service, people that are working in jobs doing cleaning, all these different areas. And I know that I physically go into work each day, but people will say, oh, but you're a doctor and this is a pandemic and you got to do your part. I'm like, okay, essential workers, but also the other essential workers out there are people that are in these positions where they have to go. They don't have the luxury of being able to sign on to a Zoom and be on a Zoom all day.
Right.
And part of that just comes from the nature of your work.
Yeah. So, you know, you mentioned that you and our dear friend Bobby is just like an amazing advocate for the API community. He's also
very much so
a total union man, and he's done a lot of work in both of those regards. So it doesn't surprise me that you two are kind of working in tandem on serving the South Sac community here. But you know, as you were saying, that you're sort of describing your experience of testing folks and, you know, just responding as best you can during this widespread emergency pandemic. Now that we do have 3 separate vaccines available to certain subsets of our community, right? Certain age, folks who have particular comorbidities that make them highly susceptible to severe cases of COVID. And now we're actually opening up to what is it, like frontline medical workers. We're opening it up to people experiencing homelessness, which Shannon, I think we'll talk about it a little bit later. Now that we are getting these vaccines out into the community, there's a big discussion on equity there, on who has access, but also who is actually getting their vaccination. Can you talk to us about what that means for the communities you're serving in South Sac?
Excellent question. As you mentioned, equity is at the heart of most of this, because even as I just shared now, if you're doing a job from home and you can do it by Zoom, you have limited exposure to other people. But if you're working in the grocery store, you're exposed to everyone coming in, checking through their groceries. And when it comes to equity, at this point in time, there are some mass vaccination sites in town, Cal Expo, in Natomas, and at McClellan Park. But as you notice from the geography of those 3 locations, none of them are in the South Sacramento area. And we are in March right now. And off the top of my head, I can't think of when those other mass sites opened. But to date, there has been maybe 2 pop-up vaccine clinics in the South Sacramento area. One was held at La Familia a few weeks ago, and then the other was held this past Friday. And that was a conglomerate effort between 14 community-based organizations and Councilmember Bain. I know that in the Del Paso Heights area, which is a region that has a large number of individuals that have been affected by COVID-19, part just because of the ethnic background of the area, plus socioeconomic status and what is it called? Financial status, for lack of better terms. That is an area where Dr. Carter has set up a vaccine clinic in that region, focusing on the Del Paso Heights region, because this was an area that was highly impacted that needed the vaccine. That was her own personal effort doing that. And right now, there is no other focus on this area of South Sac, the area south of Florin Road, where it has the zip codes where the populations have had some of the higher percentages of COVID-19. Del Paso Heights also has higher percent positivity rates of COVID-19, but they have other areas around them that are providing the vaccine. And as you mentioned, it's a concern of mine when I look at it as I'm a physician, but I also have my master's of public health, because I looked at that with health. It's not just what I manage in the four walls of the exam room. Health also depends on the factors of the world around you. And the concern is, if there's a community down here in the South area that's not having a consistent vaccine site, then how are they to get the vaccine? Up until now, most of the vaccine scheduling has been done through internet. And for me, for you, for all of us here, oh, no biggie. I'll go there, type it in, no big deal. But I'll share, this past Saturday, we learned of a vaccine site that had some spaces available. And we had a waiting list of people interested in the vaccine. And I spoke with a 73-year-old individual that when I called them and asked if I could help them sign up, they said sure, because they did not know how to use a computer, did not own one, and they did not have an email address. And this was on the CalVax webpage. To register for a vaccine, one of the required fields, not optional, required fields was an email address.
Yeah.
And so with this individual, I said, okay, if you're comfortable with me putting mine, I'll get in touch with you, but let's get you registered. Got him registered, he got his vaccine. And when I followed up with him later that day, he said, you know what? You made my day. Thank you so much for calling me, because they actually lived down the street from the site doing the vaccine. But what hurts my heart is that this person was eligible from months ago, but they couldn't get in because of the access of being able to have the technology access. Also, many of these vaccine sites have been drive-up. When it comes down to it, to have a drive-up site, you need to have a car. And so at this point in time, you're already limiting it to anyone that has a car that can get to one of these other sites. And so even though people have said, oh, go to McClellan, go to this place, you can get there. But the question is, what about the person that uses public transportation?
Right.
And they can't just get in their car and easily drive up. I don't think a bus is going to drive through McClellan's setup to get vaccinated.
This
and
was
I
the
see
same
that's been
problem for the tests too, right? I mean, there were drive-through testing sites, and it's like not everyone has a car.
Yes, and I will say for the community testing program, out of all the testing sites, pretty much all of ours have been you walk in to a space. I know people called and said, well, can't I drive up? I'd rather go somewhere that's drive up. I'm like, okay, there are ones available for that, but we're right near a bus line. So people were able to take the bus here. Some people just walked over, because when I think of equity, I have to look at it as, okay, not just what I'm capable of doing, what is the random person walking down the street able to do? And if it's only accessible by a car, if it's only accessible by doing an online sign up, even though technologically that is easier for people managing it, but if everyone can't reach it, it's not reaching everyone. I did learn recently that there are 2 vaccine clinics that will be opening up in Oak Park within the next one that's already open, one coming up in maybe 2 weeks or so. But still, again, this is not including the South Sac region.
Right. Yeah. You know, Skylar, you shared with us a piece showing that about 20% of Californians, I think, had been vaccinated, closer to 1 in 4 adults. But, you know, I think, Dr. Tetteh, you're outlining to us that this falls very much along racial and socioeconomic lines, right?
Oh, yeah. I will also add, when I was helping this person sign up, the website to sign up was mainly in English. I don't recall finding a spot that allowed you to change languages. And here at the site here for testing, we've had individuals come that speak ASL, or American Sign Language, Hmong, Vietnamese, all different languages. And most of the time materials are made in one of 2 main languages, English and Spanish. And that's where the event that happened at the Pinnell Center last Friday was such a major effort, because they had the participation of many local groups, having people present that could help interpret. Oftentimes, I've had the adult child of someone bring their parent to assist them, but that's not always the matter. I've had someone come that speaks ASL and I don't. We figured out a way to communicate, and we figured it out. But I'm like, man, I mean, I can't go learn ASL in a day, but if I could and my brain could handle it, I totally would, because it would make that exchange easier. And in medicine, the challenge is you have the knowledge, you need to help get it through to your patient. And yes, I will say big hospital systems have the interpreter video calls you can set up, or they have the phone numbers that they've paid this, that, and the other to do it, but not everywhere does. And especially with this right now, there hasn't been a lot looking at, if we're looking at all the people of California or even the people of Sacramento County, how are we going to make sure that we're making things versatile for all people? And I'll also add, not just here in Sacramento region proper, even Galt. Galt has a large number of people with COVID-19. They are part of Sacramento County. They need to be served as well. And they're also working on, well, how do we get vaccines here? Because they're still part of this county, but at times I think maybe a lot of attention is further north and not reaching them and the River Delta area.
Yeah. So can we talk about the Pinnell vaccine pop-up? How many vaccinations were given out that day?
There were 1,000 doses made available.
Okay.
And it was of the 2-dose Moderna vaccine. And the office of council member Mai Vang was involved with getting the involvement of community-based organizations, specifically within the South Sacramento region. The focus was on getting those in this region vaccinated. So each group was assigned, I'll call it, to register people. And so instead of having people have to deal with the computer end, for example, let's say Hmong Innovating Politics, they knew the people that had contacted them trying to get vaccinated. They were able to call their own people and say, oh, you're looking to get vaccinated? Let me sign you up, and sign them up.
By the way, for folks who don't know, Hmong Innovating Politics is sort of a grassroots, rabble-rousing group that Councilmember Vang co-founded with a number of friends to sort of get the Hmong community more invested in local politics and just make sure that their needs are served. Keep going, sorry.
Yeah, exactly. Oh, no problem. Thank you. And this way that allowed for this organization to be able to communicate with their community and say, oh, I know this person, but most importantly, if you know this person's family speaks Hmong, you're able to speak with them in Hmong. And this was for not just community organizations, but also churches, that they said, you're all in this region, let's reach out to you to schedule people. Because as you've heard, there's been many events in other areas where they're focused on one community. And when a link is given out, somehow others get these links, and then people come from outer areas in. And then the vaccines don't reach the people that need them in that community. So I believe that about 150 or so were made available for just walk-ins, but the rest, they said, let's just get people scheduled. So up until late the night before, we were emailing back and forth saying, okay, I have this many spaces available. Who needs them? Okay, I need 5 more slots. I have people on a waiting list. And a bunch of volunteers, about 150, were pulled together within a week's time to do the event. And at the time of the event, we had not been told if there was going to be a second event, but those that participated were told, oh, come back in this many weeks for your second dose. And as of now, that is the only event I know of at that scale that's occurring in South Sac. La Familia recently had their vaccine clinic. I believe it was this last weekend, but it was the second dose for their original first dose clinic that was maybe about a month ago.
You know, this event you describe it's really important. It's really impressive. And what I really like about it is that you are doing something that I think our state level politicians have somewhat failed in doing, which is overcoming the digital divide. You can't reach a lot of communities, especially more impoverished communities, with a press release. You just can't. And so that's really cool. That's 1,000 doses. we probably need a lot more down the pipeline. So what would you advocate for being done so that the South Sac community is served the way it needs to be in the near future?
So I guess part of it would be having a consistent vaccine site. And that it's easy to say, but I already know with vaccines, you don't just say, okay, we're going to do this, pum pum, they're in their arms. There's the proper refrigeration, making sure you have people to give them. Also, with the requirements for the state, you have to make sure it's documented properly in the state registry. I think one big part of this is when you look at how the doses are being allocated, there's a piece of the pie that's going to go to healthcare organizations, then to schools, then to all the different areas down the line. And then there are some that they're focusing on, for our populations that need it the most. I know that, in the news it's been, we're going to hold 40% are going to go to our underserved populations, etc. At the same time, that's what's being said on the state level. I'm not sure how that sort of passes down to, the community level, the county level, because I can see that in the news, but then locally, we're not seeing that happening. And when it comes to this, I think it's hard to say, okay, county, do this, or state, do this, because part of it is, well, we're busy doing all this other stuff. How can you guys mobilize? The hard part is when people are in this community are saying, well, we really need something. Why is it we are sitting here hustling, rushing around, getting things together to serve our community, where other communities, it seems to be like, poof, here's your vaccine site. Go online, sign up for it, and it's there. But it seems for other areas, it's, well, you've got to work and try to ask people and, beg, borrow, and steal and say, can we get this to work, to happen? I think I've been trying to work on, for me, being able to get access to vaccines, because you do have a whole process of making sure you have filled out the applications and all the forms and show that you have a vaccine refrigerator and everything. I'm but one person, but I feel like, okay, if I can do something that will help. But I think also one thing people don't maybe not know about these programs is there is funding to pay for the vaccines. So these organizations don't need to purchase them. The thing is, that is it. There's no money to put these events together.
That the event that was put,
correct. So the event that happened on Friday, those were all volunteers that were there helping with directing people. The people that were there giving the vaccines, I believe they were from UDC Davis, forgive me if I was wrong, but they volunteered. And so that's the part where it takes money. And if someone's going to do something, even for me, I thought, okay, if I do this, okay, how am I going to pay my staff for doing something that's not even for our patients? Even though I'm like, I do want to help people, shoot, I'll get the vaccines myself if I have to. And as a businesswoman, that is this kind of thing of, okay, I want to serve the community, but I also need to make sure I can pay my rent, purchase the vaccines for the practice to continue to function.
Right.
And I think that at this point in time, the challenge is, okay, does it need to be someone that comes in and says, I'm going to run this, put it together? Or is it a matter of, okay, will other groups sort of mobilize and do it? I mentioned Dr. Carter before. She's been doing her vaccine clinic in Del Paso Heights, where I believe the other week they might have done about 600 vaccinations. And they're doing both drive up and walk up. And they are all volunteers. She has about 300 something volunteers that have been coming every week, twice a week since February. And that is a mass effort that for her, word spread by mouth, and they've had nurses, other people have worked with her in the OR before, and they've all come together, but also that's just on people on their own coming together. That was not put together by the county. And at this point in time, even as people say, well, I think my place could be used as a vaccine center. Okay, it can be a center, but where are you going to get the vaccines from? At this point in time, if it's not a hospital group or other medical group that brings immunizations to you, you're not going to be able to get them. And I'll even share, for me to even get my COVID vaccine, it took me a while. I know I was fine with, okay, let the respiratory therapists, the registered nurses, the doctors, PAs, everyone in the hospitals, get your vaccines. I'll wait my turn. I'll be patient. I'll wait my turn. And then when it was open to people in primary care, I heard of other people that were getting theirs. And I said, whoa, you got yours? You got into a CVS? Oh, you got yours already? And even when I contacted the hospital I'm affiliated with, they're like, okay, we have a doses in Roseville. And it's at 2:00 in the afternoon on a weekday. And I'm like, but I'm seeing patients. I can't do that. And the Sacramento Valley Medical Society partnered with UC Davis Health saying, can you help our independent physicians and their staffs to get the vaccine? Since if you're in a hospital-based office, no problem. You go down to the main place and get it. But for those in independent practice, you couldn't. So I think I finally got my second dose of the series maybe 3 weeks ago. And people looked at me like, wait, you're a doctor. It took you so long to get yours. And I said, look, this is just what I'm saying. With the rollout, it wasn't clear cut. Okay, here you go. It was more like, okay, you're in this category. We'll get to you. And it was sort of a figure it out and find your spot. And I think now as we open more tiers, and as you said, today they opened it up to high-risk populations, including coronary artery disease. People have coronary artery disease, a BMI greater than 40, hypertension, COPD, asthma, sickle cell disease, developmental disabilities, Down syndrome, and I'm probably leaving off 3 more, but that was added today. So now we're at a point where you have even more people that are eligible.
And that's folks as young as 16 qualify for that as of today, right?
Correct.
Yeah.
Yes, as of today. And so we have even more people that are eligible, meaning the demand is high, but when it comes to supply, we're still sitting here with, okay, we've got this many. Yeah. And I know the storms in Texas, that's a factor, but also it comes down to access.
Right. And I mean, it's sort of gobsmacking to me that, you know, even that the divide, the geographic divide goes up to a medical professional even level in somebody who serves South Sac, has a personal practice, right? You know, we don't have these beautiful, elaborate hospitals down in South Sac. And so the doctors, the folks serving the community are people like you, right? And the fact that you had to jump through these hoops and had to wait this long to get it. I mean, that's not only disrespectful to you, I think it's also disrespectful systemically to your patients, right? The people you're serving. And it's, I guess I don't have anything to say beyond that's very galling.
You know, I guess it's just one of those things where I'm like, okay, let's just, you know, we'll figure it out. Or as I would say, I just make it work. You know, I just knew, okay, I just had to be very careful and be very careful. I will say in the early days of the pandemic, I said, okay, I'm reasonable. I'm not going to get all up in someone's face. At the same time, as we learned more about COVID, I said, oh, okay, you can have it and not know you have it, and then you can spread it to others. And my first concern was, I don't want to be spreading it to the newborns that I see, to the kids I see that might be immunocompromised. And more of my concern became, I don't want to be a vector to their illness. I was getting tested almost every other week just to make sure, for my own peace of mind, that I'm okay. Because if I caused death or illness to any of my patients, knock on some wood here, I would not be able to forgive myself. I would not be able to sleep at night. And I think that when I finally did get my vaccine, just for me, just feeling that level of relief that, okay, it's going to be all right. Because at the beginning of this pandemic, I know I was thinking about, okay, this is bad. And it's going to get a lot worse out here before it gets better. Because in the beginning, I think here in Sacramento County, things were bad. We were just hearing in the news about how bad it was in other places. And I know a friend of mine is an anesthesiologist, and I remember having a phone conversation with them, and they said, you know what? I could catch this and die from this. And it was one of those moments of, I went into medicine to serve others, didn't sit here thinking, okay, there's a risk of me dying
Right.
doing this. I thought, maybe sleepless nights, done that. Not sleeping at night because I'm on call, done that. Up late working, yeah, sure. Not seeing family, that happens too, but not dying. And a considerable number of individuals in the health professional field have died. Nurses, respiratory therapists, doctors. And I think that's one of those things that I still keep sort of in the forefront of my mind, that I don't want the numbers to numb myself to it, because these are people. These are
Right.
people. Someone that was tested here a few weeks ago, we learned recently, died. And I was sitting here going, of COVID.
Yeah.
And I was just sitting here going, but they were just here. It felt like this weird disconnect of, wait, but they were just here. And in a
Right.
short period of time, they're gone. And I think that's just still a reminder that even though we're talking about vaccines and, oh, are we wearing our masks, that there are almost 500,000 or more now of people that are not here today because of this virus. And I think that's a reminder to me of how serious this is. Also, the reminder of why we need to be vigilant, continue to be vigilant. And when it comes to the vaccine, as you mentioned, there's 3 out there. I've had friends ask me, so which one's better? And I said, the one you can get.
Right.
Don't play around. I know people have said, well, this one is not as effective. Like this one's at, this percent, this one, others like 90%. And when it comes down to it, I sort of just get plain like, okay, you don't get the vaccine, 0% effective. You get the vaccine, it's at least 50, 70 or higher.
Yeah.
You're more protected by having it than having nothing.
Right.
Yeah.
And
I'd
yeah.
like to drive that home too. The Johnson & Johnson one, a lot of people are trying not to get that one, right? I got that one. And I think that one's really important. And I think it's important to advocate for that one, because the numbers show that all 3 of them are 100% effective so far at people not dying, which is what we're trying to succeed at, right? So it's totally okay. And not only that, like, there are side effects for some people with the other 2 vaccines that make you feel like you're sick anyway. So like, if there is a 15 to 25% chance that like you get a mild iteration of COVID, like, I mean, that's okay as long as you stay home, that you're not spreading it to other people. What we're trying to do is systemically blot this out. And in order to do that, we have to be okay with any of the vaccines.
Right. And as you said, I've met people a parent that told me, oh, I felt lousy when I had COVID. I felt lousy, 3 weeks of feeling lousy, but I still had to take care of my kids. Done. A colleague of mine in Los Angeles had COVID. They usually run 10 miles a day. They were so worn out, they couldn't even walk up a flight of stairs. And they were that way for months. And as you mentioned, with the vaccine, you're protecting yourself from serious illness and death. I'm pretty sure most of us are trying to avoid that.
Right.
And even when we look at the flu vaccine, I think the most recent statistic I saw was in 2020, the number of deaths to children from flu was 1. Previous years, it's usually been in the hundreds.
Wow.
And exactly. And I'm just sitting here going, wait, what? Hello, what? And part of it too is the flu vaccine. I'd have to look it up exactly. It is not 100% effective. I've had children that we gave the flu vaccine, but then they caught the flu. It looked pretty ill and everything. But you know what? They get through it. And I think people forget how deadly the flu can be, because around them, they're like, oh, people I know, they're fine. Not a big deal. But others are not. And that's why we have thousands of deaths due to flu. And right now, same kind of thing. I've had people say, well, I got COVID. Not a big deal. It was just a little illness. But that is for you.
Right.
The difference is for the person that doesn't have health insurance, or if they caught it and if they don't go to work, they can't buy their groceries. They're going to figure out something to do. And actually, I think Dr. Carter made this point recently on a call I was on not too long ago, when we talk about equity, the question is for the person that's 68 years old, has insurance, has a pension, lives in a good neighborhood, compared to a Caucasian person in an affluent area, healthy, a 68 that can get the vaccine, compared to the person that's 43, African American, working 2 part-time jobs. How is it that we have a difference there? That's not equity at all.
Right.
Same with how thousands of doses can be made available in the more affluent areas of our region. The areas that are not as affluent, not as much. And
So,
it kind of,
Doctor, because we got to move on a little bit pretty soon, but I want to ask, how can our listeners help to make it so underserved communities that are affected by the digital divide, communities of color, people who are socioeconomically in different stratospheres than other folks, like for instance, what can we do to try and make it so South Sac is served in the way it needs to be, in the way, like, what can we do to advocate for, if not more pop-ups, like actually something that is a brick and mortar day to day?
Oh, gee, that is the question I've been trying to answer. I think, sure, for me, I'm trying to get my ability to get the vaccine, because at this point in time, things are just sort of tied. I would say for advocating, there are individuals that set up the allocations for vaccines and how they're distributed to the healthcare centers, to the schools, etc. And I believe advocating for, at the state level, or if it's the county level, whoever's in charge of making these allocations, saying, hey, could we make sure that maybe we pull some from this amount that goes to here, to here, to here, to make sure for the underserved population that the governor has stated we need to serve, can we make sure that there's more for that basket of vaccines? Because from what I've been told, that is the reason why there's only so many vaccines, like for this pop-up, was because they only have so many toward equity measures. And in my mind, when it comes down to it, I know hospital systems, they have a certain number, but at this point in time, I feel like we are here bargaining and calling people going, oh, did you hear about this? Oh yes, I have a person. We're like backdoor bargaining, trying to find people's slots here, there, and the other. And different health systems have said, oh, we're offering the vaccine to whoever needs it. And I feel like, well, if we make sure we get it to the people directly that need it, that can't go to their health professional because they don't have one, or they can't make it to the clinic that's during the middle of the week, in the middle of the day because they're at work. Being able to say, here, can we allocate more from the big pie of the vaccines to go specifically to this role, so that organizations that are trying to do vaccines to serve underserved populations are available to do it.
Okay.
I think also, oh yeah, go ahead.
So it sounds like what I'm hearing is a concrete thing to do would be to reach out to your county board of supervisor member and say, and ask them to focus on these communities. You know, not only the governor has said that they have promised that 40% of vaccines will be going to these communities, but it doesn't feel like that's the reality right now.
Yeah.
And also maybe include Dr. Kassirier, who is the public health official for the county, in the email to your board of soups member.
Yeah, because I will say, I know I don't have a lot of pull on different things, but I feel like in my own little corner of the world, what can I do? Which is why I said, okay, let me see if I can get the vaccine. But still, I know there's other ways to be more productive in this effort. I think also, if there is able to be a consistent site in South Sac, as I mentioned before, there's no funding to run these sites. They're all by volunteer.
Right.
That if people are lingual in more than one language, making yourself available to be able to come. And also, not all the time at these vaccine events do they have vaccines for the volunteers, part because they're trying to focus on giving them to the people that the event is for. That being okay with that, not making that I must have it, or I'm not going to go and do this. Or if you've been vaccinated, making yourself available to come and help out. I think at this point in time, the challenge is, sure, there's a need, but who is going to fill it? And not just, well, the city needs to do this or county needs to do this. It has to be a sound plan of, well, will this organization step in? At least at this point in time, as we've said before, time is of the essence right now in this pandemic. It's not a matter of, oh yeah, we'll get to it eventually. Like, oh, we'll fix this road or something like that. At this point in time, we need to vaccinate as many people as we can, as soon as possible, to get as many people vaccinated so that we can reach herd immunity. Right. And at this point in time, if we only have a chunk of people up here getting the vaccine and the chunk of people down here haven't, we're not working with each other very well. We're not helping everyone as well, because we are literally in this together, that if one part of the area hasn't gotten the vaccine, well, we're still here fighting it. We still have people getting it. And part of being equitable is making sure that we're looking out for everyone, not just some people.
Absolutely. Actually, that reminds me, Shannon, can we discuss serving the unhoused community, how to get them vaccinated? What is going on on that front?
Well, I mean, I wish I had more to say about it, honestly. I think this news, we started to hear buzz of it in the middle of last week. And then in the circles that I run in, I started to hear more and more that the news was going to break on Monday, that people experiencing homelessness or unhoused people were going to be eligible for the vaccine, along with transit workers and food service folks and, you know, the folks that Dr. Tetteh mentioned earlier in the show. And at this point, if we're talking specifically about people experiencing homelessness, there is not a plan that is rolled out that I can say right now, this is where a person experiencing homelessness would be able to go and receive their vaccine. What I can say is that there's a lot of push for the Johnson & Johnson vaccine for people experiencing homelessness, because what you really are trying to do, especially when you're working with housing insecure people or people who find are don't have security in all different ways, financial, healthcare, all of these ways, is if you can just do the one and done thing, that's the best way, right? Mm-hmm. So at this point, there's a lot of discussions around how people experiencing homelessness are going to be able to access this vaccine, if there is an issue of like computer literacy in general. If a person doesn't have ID, that creates a barrier. If a person doesn't have transportation, if a person is so deeply, in their encampments that they potentially aren't going to be able to, that they don't even know that they're eligible for the vaccine. The other thing is being able to pick away at now a year's worth of misinformation around the vaccine, and then the buildup of misinformation, especially I feel like what has happened in the last couple months, that I'm hearing a lot with the people that I serve, like, I don't want that vaccine. I don't want that shot. Right. So working around that, like my disappointment, again, I'm always the one who's disappointed or angry or whatever, is that if we want equitable access to the vaccine, we have to think about people experiencing homelessness. It has to be a forward-thinking approach to getting them that vaccine, which means that months in advance, there should be community outreach workers going out there answering questions, talking to people about who wants it and who doesn't. Do you camp in this space regularly, so that they can do, pop-ups essentially in spaces where people are finding themselves sleeping outside at night. So, again, that's not a lot of answers, but it is good news that after being deprioritized in the beginning / middle of January, people experiencing homelessness and others are now eligible for this vaccine. And I will never miss an opportunity to call out that the Sacramento County Department of Public Health is terribly underfunded as a result of money going to the sheriff, right? When this pandemic hit the hardest. We were watching the county submit request after request for funding to do just like the bare minimum. And if we're talking about equity, we also have to talk about equitably funding from the top, right? The services that are facilitating the distribution of the vaccine. So like while Dr. Tetteh is struggling to get the vaccine in her community, had the sheriffs not taken millions of dollars, there could have potentially been staff to then have a more equitable distribution plan. So if we're talking about
over $100 million, the sheriff took.
Oh yes, many millions of dollars. So
which was supposed to go to COVID. Yes.
So we can, in terms of like, this new tier of people who are eligible, we're still sort of waiting to hear how this rollout is going to take effect. And that, and this is one of those things where I don't want to blame the county just yet, because I realize how spread thin they are. There is one person, her name is Megan, who works at the county, who is doing the job of 7 people at the County Department of Public Health. And Dr. Kassirier, right, is also probably doing the job of 20 people, right? So I think it's a waiting game at this point. But if we want to expand on the call to action, the advocacy that Dr. Tetteh spoke about earlier, it is, one, making sure that we're pushing for equitable access in communities that are otherwise frequently forgotten, but also I would say like urging ourselves, our friends, our communities to take a look at how our county is funding our Department of Public Health, because once we reach herd immunity, I'm not a doctor, but as I understand it, it doesn't mean COVID is over, right? We don't understand what the long-term implications of COVID are on the determinants of health in various communities, specifically in the communities that Dr. Tetteh is serving. So we need our Department of Public Health to be fully funded so that they can address the issues that are going to arise, so that we have a robust plan moving forward and we can potentially reach that equity outcome, right? I'm watching the clock tick, so I'm talking faster than I usually do.
But I mean, nailed it. One thing I hope the powers that be consider is, where can we meet our unhoused community that isn't an inconvenience to them, because every day they are just trying to get through the day. So think about where the points of contact are. Perhaps set something up at a Lowe's. Perhaps set some things up at all of our shelters. Perhaps set something up in Cesar Chavez Plaza or the warming centers at night. Meet people where there are, and maybe something roving. Maybe send people through the American River who actually have built a rapport with folks like the mutual aid medical workers that have been working so hard all year long.
I think the other part of that I would encourage is that there are communities that frequently, for the years that I've been working on issues surrounding homelessness, there are communities that deny that people experiencing homelessness exist within them. And so when we think about making sure that there's equitable access points for the vaccination, we have to be thinking about every community, every neighborhood, because just because you don't see that there's a person experiencing homelessness in your community doesn't mean they're not there. So we have to start thinking, like, certainly the River District is like an easy spot, right? Downtown, city center, Chavez Plaza sounds like a great spot, but we also have to think about places like Galt, right? Like, we have to start thinking about places, out in Meadowview, again, in the neighborhoods that Dr. Tetteh is serving. Just, it's not like, let's think outside of the easy bullseyes and consider the entire city and the entire county, because we're talking about county when we're talking about vaccines. So think big. It would be cool if the sheriff didn't have all those millions of dollars.
I believe that's true.
Mm-hmm.
We are really under the gun now. Dr. Tetteh, I want to thank you so much for coming on and discussing all of this with us. And just thank you for all that you do.
Yes, thank you for having me. It was my pleasure. And I agree with Shannon's points just a lot regarding funding public health. I wouldn't have gotten my master's in public health if I didn't see the importance for it. And this is really, I mean, I may be a pediatrician, but treating kids is part of also treating the community, because the community helps raise these kids. And that's where my passion has been, especially with this.
Absolutely. Just so folks know, you can find Voices River City stuff at voicesrivercity.com. It is almost, what it now, like 4 years of Perfect Takes? I don't even know. We are at on Facebook, Voices River City, Twitter and Instagram at Voices River City. You can support us and get double the episodes every month. Patreon.com/Voices River City. I am on Twitter personally at Kempa. Why are you KNOWKEMPA?
You can find me at Guillotine for You. That's Guillotine, the number 4 YOU.
You can find me at Shan N.D. Stevens.
You can find Flo at Flojaune. That's FLOJAUNE.
And Dr. Tetteh, how can we find you online?
You can find me on Facebook, either at facebook.com/DocTetteh, T as in Tom, E as in Edward, TTEH, or facebook.com/TPedHealth, and on Instagram at TPedHealth, and Twitter at TPedHealth.
Look at that.
Great.
Well, Dr. Tetteh, thank you again for coming on the show. And to our listeners, thank you for listening to the show once again. We will see you soon, but in the meantime, we want you to know that we love you and we would like you to stay safe.
Stay sane.
Stay healthy.
And stay the fuck away from me.
Hey.